Hello and welcome to Canvas the Niger-Delta Roundtable, where I discuss the future of this region blessed with hydrocarbon resources. Now, every week, we give time to reflecting on topics relevant to the development of the Niger-Delta and her people. This episode is no different. I'm here once again to focus on how to take this region to a more promising future. I'll be reminded the program is sponsored by the operator of the NNPC Renaissance to Total Energies Archive joint venture, the Renaissance Africa Energy Company Limited, headquartered in Port Harcourt. Thanks for joining. I'm Adid Dayo. It was shocking. Now, the topic for this episode of the podcast is immunization is still saving lives. World Immunization Week, celebrated in the last week of April, aims to highlight the collective action needed and to promote the use of vaccines to protect people of all ages against diseases. This year, 24 to 30 April, is World Immunization Week. This year's theme is Immunization for All is Humanly Possible. Vaccines have been one of the most significant advancements in public health, saving millions of lives and preventing countless diseases. Over the last 50 years, essential vaccines have saved at least 154 million lives. That's 6 lives a minute, every day, for 5 decades. In these 50 years, vaccination accounts for 40% of the improvement in infant survival, and more children now live to see their first birthday and beyond than at any other time in human history. Measles vaccine alone accounts for 60% of those lives saved. And despite the progress we've made, there's still much work to be done to ensure everyone has access to life saving immunizations. In this episode, we'll delve into the importance of vaccines, challenges we'll face in achieving global immunization, and the incredible stories of how vaccines continue to protect communities around the world. We'll also discuss the role of immunization in achieving the Sustainable Development Goals and how we can all contribute to a healthier future. Again, a topic on Canvas this week is immunization is still saving lives. And my guest is Dr. Iwong Joseph Urang. Dr. Inwong Joseph Rang is State Immunization Officer for River State. Dr. Rang, hello to you and welcome to Canvas, the Niger Delta Roundtable.
Thank you. There. Thank you. You almost called the name like the Zimbabweans.
Please,
The Urang is the name.
Urang.
Urang.
Okay, can you call the entire name?
Iwan Joseph Urang. Iwan means good. E, the N is silent.
Okay.
Iwan.
Oh,
Yes.
thank you again and welcome.
Thank you.
Let's start with the very first question. We've made a lot of advancements as far as healthcare, prevention, and even treatment is concerned over the years, the last decade, and even beyond. Why, in spite of this medical advancement, is immunization still very crucial as far as providing healthcare is concerned?
Well, let me start with the fact that immunization is one of the medical advancements as well. I'm sure in 1978, when the Alma Mater Declaration was done, that's focused primarily on primary healthcare services, how to improve them. Immunization was the key thing on the table. Even when we have the Millennium Development Goal, you look at the role of the goals is bordered around saving lives and how do we save these lives? Immunization. We moved from Millennium Development Goal. Now we have the SDGs and all that, and we have immunization as a key issue. So when you're talking about medical advancements, the advancement is not just limited to the clinical services. It's limited, is expanded to that of the preventive services. And when you're talking about preventive services, the key thing is immunization services. So the bulk of the disease we see that have capacity to cause outbreaks are mostly vaccine preventable diseases. So how do you solve them? It's not about having good hygiene because everyone might not have good hygiene. It's not about living in less crowded area. Everybody don't have the capacity to live in less crowded area. So how do you solve them? is vaccinating them against that particular disease. So immunization is top,
Mm.
the top burner on medical advancement. Medical advancement in the sense that how do we get to these people? How do we convince them? What are this category of people that we need to reach? Are they young people? If they are young people, what methods are we going to reach them? So we now leverage on, is this social media we need to reach them? Are we using the conventional media? Are we using the town announcers? All these things are still medical advancement that we use in reaching these persons to see how we can prevent these diseases. So medical advancement on one side, I know you're talking about how to do pinhole surgeries. That's medical advancement. But that is for surgery. If you prevented the disease, will you go to the facility? No. If you're well, there's no well person that goes to any clinic or any health facility. So we are saying we are treating the community not to get the disease. But that doesn't mean that one or two persons will not get the disease. So you need to provide services and make sure those services are top notch. So the advancement is on both sides, both on the preventive side and on the clinical part as
How do vaccines accomplish this? In some cases, we hear of eradication of certain diseases in some communities or parts of the world. In fact, there are parts of the world where we have a generation that doesn't even know of the existence of certain diseases because those diseases have been said to be completely eradicated, in those climes. And in other cases, we've had uh, vast cases of decreases in the existence or in the people contracting those
well.
ailments.
Diseases.
So, how do vaccinations or how do vaccines accomplish this?
In 1979, when the last case of smallpox occurred in the world, it was attributed to vaccination. So smallpox has been eradicated in the world. I don't know if you've heard of smallpox anytime. Currently, we have polio that's at the verge of being eradicated. So in the entire world, we have what we call PA. Before it was pain. Pain means Pakistan, Afghanistan, India, and Nigeria. India left. It became PAN. Nigeria left. It now became PA, which is Pakistan and Afghanistan. That is the only two countries in the entire world where you have wild polio virus. Yes, immunization has been the key, major player in ensuring that we have that. We're talking about eliminating measles. I'm very careful in using the word elimination and eradication. Elimination, you're trying to control it and make sure it's occurring, well, sparsely. You're not seeing them that much. Eradication, you're not seeing it anymore. So we can't really say we have eradicated measles because from time to time we still have people that come down with measles. Now, the key thing that you need to understand with this is WHO has said it clearly. If you stop vaccinating, these diseases that you've been trying to prevent, trying to eliminate or eradicate, they will all come back. So if we don't reach large number of persons for these vaccine preventable diseases, they will come back and come back stronger. So it means the immunization will continue until we are very certain that we're not seeing the disease again. Because now, like you said, a young child that was born after 1979 will not have any experience of smallpox. I personally did not see smallpox, though I was born earlier than 1979. But I've not seen any smallpox case. I wasn't vaccinated against smallpox. I have not done vaccination against smallpox. I only read it in the books that there was a disease called smallpox, where the world woke up and said, we can eradicate this. So now we have woken up and said, we can eradicate polio. So we need to work on, make sure every child is vaccinated. At that point, we eradicate the disease. We are already targeting to eradicate measles. We're working towards that. If you look at 10 years ago, how many cases have you heard about measles? Compare it to now. You obviously see that the number of cases you heard about measles have drastically reduced. That means immunization is working. In anywhere I go, I am proud to tell you that the only public health intervention that is still working till today that can stand the test of time is immunization. So we need to continue to do that.
Immunization employs vaccines.
Yes.
And I know in the previous episodes of this podcast, Canvas, we discussed vaccination. But if you could, not with you necessarily, but could you
Yes.
explain how vaccines work?
First, there is, I will I say, an interchange of terms. Vaccines are the antigens we inject. So the process of injecting the antigen is called vaccination. Now, when the vaccines get into the system, it now stimulates an immune response. In the local parlance, we say you have body soldiers, so you go and wake them up and say, give them a memory of this is the disease we're trying to protect. So they now have, how will I put it? Um, they become aware that this disease can come. So anytime the disease come, they take out the disease without you, the owner of the body, knowing that the disease came actually. So the vaccines will go stimulate immune response, and once they stimulate immune response, you now have the person immunized against the disease. So anytime the disease comes, the body just take care of that particular disease. So that terminology, vaccination, is the process of giving the antigen, be it by mouth, be it by injection, whatever method you give. Then the process of having protection against the disease is called immunization. So people use those terms interchangeably. When they say immunization, probably they might be referring to the vaccination process. But if you now look at the vaccination is and the immunization itself is the conversion of the vaccine to now become the person having protection against the disease.
Mm.
So those are the clear definition of those terms.
Well, you made a distinction between elimination of diseases and eradication just a while ago. And if I remember correctly, elimination is the reduction of
Yes,
cases.
significant reduction.
Eradication is it
You're not
disappears
seeing it at
completely.
all. Yes.
But you also mentioned before that immunization must continue, else the disease returns.
Yes.
Now, if there's a possibility of a disease returning, can we then say that we can entirely, completely eradicate or cease to exist a particular disease?
Yes, depending on the host of that disease. Like smallpox, I use as an example. The only host of smallpox is humans. So if you get all humans within that period protected against the disease, you won't have the disease thriving anymore. Measles too, the only host of measles is humans. So if you get everybody protected against measles within this period, then measles won't have anywhere to thrive. So it's only when you don't have protection in some parts. There are some people you've not reached with that protection. Then obviously measles can be spreading so that once they see somebody that doesn't have immunity against the disease, it now catches that particular person. Though for measles, initially we're looking at what we call herd immunity. Herd immunity, when we get 70, 75%, 80% or thereabout, people protected, we're not really bothered about the few persons because the disease can cause an outbreak. But now everybody is saying, we're looking at if we want to eradicate this disease, then we must get everybody protected. So nobody is now pushing the concept of the herd immunity. Everybody is pushing the concept of eradicating the disease. And what does it mean to eradicate the disease? To get everybody vaccinated. So it depends on the disease. The diseases that occur in the environment and is vaccine preventable disease, that is very difficult to eradicate because you have to now look at environmental sanitation and make sure you eradicate the disease in the environment and in the human host. So, but if the disease is only in human host, it's very easy for you to eradicate because you get protection in all humans. So, when we are discussing about eradication, you look at those concepts clearly. So, who is the host of this disease? For instance, you're looking at Ebola now. Ebola is the monkeys and the rest, and birds and so on and so forth. They're all host like humans. So, how do you eradicate that? So what you want to do is just to get the humans protected. So in case they get close to any of these other hosts, they will probably not come down with the disease. So it's very difficult for you to talk about eradicating them because you cannot sanitize all the birds and vaccinate them or the monkeys vaccinate them. It's very difficult for you.
So, if the disease causing organisms themselves cannot be eradicated or are not being eradicated, so to speak. In other words, for example, you mentioned smallpox a while ago, and smallpox in humans has been eradicated. Am I
Yes.
right so far?
Yes.
However, the organism that causes smallpox still exists somewhere in the world. Am I
It's
right?
nowhere.
It's
It's
nowhere
only in
at
the
all.
labs.
Okay.
It's not only in the labs. Because
Okay.
the only host is human.
Okay.
And everybody has been vaccinated.
Are there
So,
other ailments? You mentioned Ebola, for example, which
yes,
thrives in other living organisms. Am I
yes.
right? So, can we truly eradicate something like that, Ebola, for
It's
example?
very difficult. You only control. For those ones, you just keep it at the control phase and make sure you control them.
So there are those that we can't eradicate then.
Okay, let's use yellow fever for instance. Let's use malaria for instance. You need to look at the environmental control. There are malaria vaccines now. So if you give people malaria vaccine, that doesn't stop malaria completely because the Anopheles mosquito is there. So it's spreading not as humans, it's spreading in the environment. So once you have environment that are favorable to it, it happens. Look at yellow fever, for instance. It's possible to eradicate yellow fever. But how do we eradicate? You're not just looking at humans alone. You're looking at the host, the vector that carries the virus and all that. So look at dengue fever as well. Yes, there are vaccines now for dengue fever. But you're looking at the other host, be it intermittent host, be it a transient host, it is not only humans. So you can't be talking about eradication at that early stage. What we'll be talking about is control. Let us control so it won't spread. But the ones that you know that is only humans, for instance, measles. Who other organism has measles? Have you seen measles in monkeys? I'm not sure. So it's basically they have affinity to humans. So if you're able to vaccinate everybody, you'll be able to control, eradicate that disease. So in these other ones, we'll talk about the control phase before we're not talking about like so many countries have eradicated malaria. They don't even have mosquitoes that contain the organism. So it means that they combined these two aspects, protecting the humans and making sure the environment doesn't have infected mosquitoes. So coming to third world countries, coming to poor resource countries, of course, in everything in this our side is more political than reality. So that's why you obviously I don't want to make inferences, but this one is very key. Where we have in Cambodia, you have stagnant waters, and if you're able to fumigate the surface of those stagnant waters, you kill those lava and the rest of all that. But in River State, we have a moving water. Waters are flowing. So if you pour the larvicides on the surface of that water, what happens? The water flows with it. So the mosquito will come back and perch on a clean water and will not die. So using the theory of Cambodia and carrying helicopters to spread larvicides in our surface of water, that wouldn't solve that. So our environmental sanitation is key. Okay, let's assume like in previous governments we have been able to do that. Did you build a wall from Akwa Ibom so that the mosquitoes in Akwa Ibom will not come into River State? Or did you build a wall in Abia State so that mosquitoes in Abia State that are infected already will not come into River State? Did you do that in Bayelsa? Neither did you do it in Delta or Imo State. So it means that this is an effort that is to be done together as a country that want to eradicate this disease. Then we'll now start focusing on it. So eradicating on paper is different from eradicating on the field.
Mm.
Clear differences. So in this case, even having malaria vaccines will not help you eradicate because you need to treat the source.
No, in I believe what you know attempt to explain also the importance of or the necessity of immunization a while ago. You
Yes.
explained that we can't get everyone to live in a certain way in terms of personal hygiene.
Yes.
We may not be able to get everyone also not to live in densely populated areas, which also has to do with environmental factors, but we can immunize people. But even as far as immunization is concerned, it's also tedious, maybe even impossible to get everyone immunized as well for a number of reasons.
It's
And
difficult.
these days we have all sorts of conspiracy theories making the rounds. But we'll get to that in the course of this conversation as well. So my point is, while we may not be able to completely tackle the environmental factors, we also cannot seemingly get everyone immunized as well. So how does that help?
That's where the issue is.
So I don't know what I mean is, so how does immunization help as well with either elimination or eradication? Since we
Or even
can't
control.
exactly, since we can't also get everyone immunized.
That's first the education part. That's what we're doing now. People will listen to it and they will understand these concepts and know that they need to take their children or their wards or whatever category they have to the health facilities. Or when they see health workers, they will embrace them for them to vaccinate available vaccines. Now, the story of the anti-vax groups, they're always there. Anti-vax groups, they can wake up any day and tell you anything. And you know that this negative news flies more than positive news. For instance, somebody comes to your studio or anywhere, or even on social media, and say Dr. Rang is a bad person. There are so many that we even ask, what did he do? They will even share. In the next 1 hour, you have more than 300 shares. I said it, Dr. Rang is a bad person. Another person comes up and says, Dr. Rang is a good person. You hardly get likes because they say, don't give her money now. So that's why it's coming to praise him. So people like, naturally, they like bad news. So even in immunization, that's the same thing. People like to hear, oh, they said they vaccinated people with COVID vaccine and they died. Even in my office, somebody has come to me and tell me that, oh, the COVID vaccine will vaccinated the person. It's shocking the person. Anybody that touches the person will get shocked. And that's okay. Can I touch you? Say, yes, I touched. Say, oh, because you're wearing shoe. I removed my shoe, touched. So, oh, it's because you are the one who vaccinated. That's why it's not shocking. So it means that the vaccine knew me as somebody who vaccinated. So it has decided that it will not shock me and it will only shock others. Notice our mentality of people. Anti-vax groups, so most of them don't even think. Some think and add scientific evidence to it. And all that, at the end of the day, is still the same thing. What I tell people clearly in most cases is that what do we produce in Africa? Nothing. Even the vaccines we vaccinate our children are produced outside because none is produced in Africa. Majority of them are gotten from donors. It's not our government that are purchasing them until recently that the donors are insisting that government must buy. Now, all those things, we are depending on this same outsiders we are talking about. The same us now come back and say they want to kill us. So if they want to kill us, even the Okrika wake up we are wearing, are we the ones that are producing them? So it's just anti-vax group that like sending negative messages and not looking at the real issues on ground.
Interestingly, you already addressed a part of the question I was going to ask you next,
Okay.
which is what are some of the misconceptions? I would
Yes.
like you to elaborate a little bit more on that. But before you go into that, which has to do with the anti-vaxxers, as you mentioned, still on the earlier on our earlier train of thought. So we can't vaccinate everyone, or not
Yes.
everyone will
It's
be part of an
difficult.
exactly.
Yes.
But in spite of that, you've been able to eradicate certain diseases like smallpox.
Yes.
How did we do that? Because the whole concept of anti-vaxxers and misinformation or misperceptions or conceptions about immunization or vaccines have existed for as long as we have. So, how did we, in spite of these challenges with immunization, achieve eradication of a disease like smallpox?
Well, smallpox, I wasn't there when it was eradicated. I'm struggling to be part of the team to eradicate polio. For Nigeria, yes, I'm part of the team. But we want to achieve it at world level. But what I knew that happened as at that time, from what I read and all the whole of the discussions, is that there were commitments. And the spread of the anti-vaccination group wasn't this high. Because look at the benefit of social media. Somebody can stay in the US, do a video, and send everybody sees. In 1979, it wasn't like that. Everybody understand the concept that this is smallpox, and they start vaccinating. If you even see the syringes that time they were using, very giant syringes. So modifications haven't got into it. But people understand that we need to eradicate this. So they started doing one-on-one campaign, talking to people and trying to see how they can convince them, showing examples of this is the disease. We don't want you to get this disease. If you don't want to get the disease, can you get these vaccines? So the anti-vax group wasn't as high as now. I think that's one of the things that led to, and countries got committed. Countries got committed, and everybody agreed that we need to eradicate this disease. The only last part is in Africa, and we need to clear it out. And everybody got committed. Now in these countries, in this world now, the anti-vax groups are waxing strong. They give you evidences, including scientific evidences. They show you researches that you hardly will want to dispel them,
What are some of the other misconceptions that are spread?
apart from the anti-vax group.
No, no, no. The anti-vaxxers, that is. You
No, no,
mentioned a
no.
while ago they say the vaccines make you,
Is
I
it
don't know,
sterility you're talking about?
whatever it
In
is.
the
Go on,
north,
yes.
sterility. Even I was in one of the churches one time talking about COVID vaccination, and the pastor said clearly in front of the church that anybody who takes COVID vaccine is going to go to hell. There's nothing I can say there, so I just will leave. Because I came to tell them how COVID has been killing people and all that, and people need to get vaccinated. And the pastor has told them that anybody who takes COVID vaccine will go to hell. Is it the antichrist part? Is it the Bill Gates part? Bill Gates wants to wipe out the entire Africa. Is it the sterility part? Like, look at, we're doing HPV vaccine, human papilloma virus vaccine, trying to vaccinate girls around 9 to 14 years to see how you can prevent them from cervical cancer. And people tell you it's sterility. Like in River State, I have only one daughter. I had to bring out my daughter and say, okay, let's vaccinate my daughter. Even with that one, people are still telling me that, oh, it's not, you're not sure it is the vaccine they give to that my daughter. That is possibly that is water. So I'm using that one. So you understand this concept, they just wake up any day and bring up one story. So you can't really predict them completely. And all that.
How do we address these misconceptions?
We have been trying to address them. How do we address them? Basically, we try to raise issues. As they raise their issue, we counter the issue. Like I told you before, the negative news spreads faster than the positive news. So you cannot always meet them up. So what we are doing currently is always putting up the real stories. Cervical cancer can kill. This is how you can prevent it. This how you can treat it. But the best method of prevention is getting your child vaccinated. And the earlier you get that child vaccinated, the better for you. Then we have routine immunization schedule. If your child is able to take these vaccines, you have already protected the child against it. So regularly bringing those things up, not minding what the anti-vax group will say. Anytime we release their rumor, we now counter the rumor. But it's a difficult thing. And why I said it's a difficult thing is that most of these anti-vax groups are the educated people. And for instance, a doctor comes up and tell you HPV vaccine will sterilize the child. How do you expect the patient to do? That patient that believes so much in the doctor, who now said, because of probably, in quotes, lack of knowledge, doesn't even understand what he's saying. He says it will cause sterility because he has watched one video. So the mother will say, oh, my doctor said it's difficult to convince that kind of mother. So it's a difficult thing, but we'll continue to try and hope that people will understand what we're saying.
In the introduction to this conversation, I reeled out some numbers, some very impressive numbers of the lives vaccines or immunization has saved over the years, over the last 50 years or so. But whilst for some persons it's easy to consume that information and understand the significance of immunization, for others, they're just numbers that mean nothing to them. So, do we have actual examples, scenarios in our climate, maybe even our local communities, of the impact of immunization, the lives it has saved? Do we have practical examples that we can make reference to?
I've been a victim of measles. When I was born in the village in Andoni, and at that time there was no health center. Vaccination was almost like a luxury. So I'm sure I didn't get those measles vaccination, and I had measles. And I knew a lot of children at that period that had measles and died from measles. Probably I'm one of the lucky chaps that had measles and they didn't die. So what I'm trying to say is the number of children that have died from vaccine preventable diseases, which majority of these communities have attributed it to um, father's wife issues, mother-in-law issues, somebody who doesn't like your father issues, and all that, have drastically reduced. Because you are now seeing people dying for what is not preventable. For us in immunization, we actually look at any child that dies from a vaccine preventable disease. That is probably is purely a preventable death. If we had given a jab, if we had completed the vaccination process for that child wouldn't have died. So there are testimonies everywhere. Ask people, call any parent and ask, in the last 10 years, what have you seen? In measles, in diphtheria, in tetanus, and all that. Now we hardly see neonatal tetanus, not to talk of maternal tetanus. Those are success stories of immunization, not just in River State, in all part of Nigeria. So for River State now, you hardly hear of neonatal tetanus. At most, the whole of this year is only one neonatal tetanus we've gotten. But compared to 20 years ago, compared to 10 years ago, you don't have that. You have rapid number of tetanus cases. Diphtheria, what of whooping cough? You've heard of whooping cough. Pertussis, a child will cough and cough and cough and be hanging. We ask clinicians, and they will tell you that they've not been seeing those cases. Now, what we are trying to struggle with is what we call the winning immunity in tetanus. So children who are vaccinated, after some time, the immunity wins out in preschool age and school age. So we are now making advocacy that for every child who is going to go into school, the Nigerian government should approve that we have a booster dose, which is based on WHO recommendation, so that you can take care of that as well. So we are moving from having issues within the before preschool age and that lower part because we are vaccinating large number of persons. Yes, we have not reached there. We have not vaccinated everybody, but the disease burden is dropping, and it's very key for us.
Besides, the activities of anti-vaxxers globally, I mean, because we talk about achieving global
Yes.
immunization, but especially in our climate, what are the challenges with achieving mass immunization besides the misconceptions and activities of mass or anti-vaxxers rather? What are some of the other challenges with achieving mass immunization?
Well, first, immunization is one of the biggest programs that require large amount of funding. For instance, we did measles campaign, and that measles campaign, only the logistic payments was above 150 million.
As in
In
River
River
State?
State.
Okay.
Only logistics. Logistic paying the amount they pay the people on the field is not usually big. I think it's about 15,000 per day, and you have 3 4 persons sharing that 15,000 per day. So let's assume the program run for 5 days, 6 days. So times 15,000 per day times the number of days. That's what they get. So when they share it, the highest they will get maybe 10, 12, 15,000 for the number of days they work. The times that total number of teams. Let's say you use 2,000 teams. So you times 15,000 times 2,000. That gives you the volume of money that will be paid by the partners and all that. So immunization is capital intensive. So funding is a problem. So if you want to get to where do we see these cases breeding? Majority of the times is the hard to reach areas. The disease doesn't know urban center and rural centers and hard to reach areas. So for urban centers, we have enlightened people, people who can go to the hospitals, who are good in health seeking behaviors and all that. And all. In rural centers, maybe they might be good in seeking healthcare, but the healthcare is not available. Maybe they might want to go, the transportation is not there. So we have to bring services to them. And when you're bringing services to them, the cost of running that is one side. Now, leave that side apart. Ownership. Do we really believe that immunization will help improve our health status? That's the community level. People need to accept that. So if people accept that, they will probably be receptive of the immunization thing. But you've seen in some few cases where communities even tell you that they don't even want to go. Our problem is not even this disease you're talking about. Obviously, you need to understand first that immunization is trying to prevent you against a future disease. Unlike the person who wants to go to the hospital, let's say my head is aching me. I am very, very uncomfortable because my head is aching me. So I want to seek a doctor's advice, or probably see the doctor. So I am the one looking for the doctor. So anything the doctor advises me, I will do. Or I have appendix, I want to go and remove the appendix. It's already inconveniencing me. I see the surgeon's okay. You have to fast for 1 day, 2 days, we'll do a surgery on you and all that. If you don't do that, then you leave the hospital. So the doctor is not coming to beg you. But in immunization, you're telling somebody that your child might have cervical cancer in 30 years' time. So you need to take the vaccine now to prevent that disease. And you know, blood of Jesus is everywhere. So they will plead, but it's not my child. Blood of Jesus covers my. It's your child. It's your father's child. It's your mother's child that will have cervical cancer. So you're dealing with two set of persons. Convincing them is taking totally absolute different methods. So those are the challenges we have. Of course, the government will is key, and I know we have been enjoying the political will in immunization services, but of course, we need to push it further. Then I've talked about ownership at that level. Then the small myths, like we've talked about, those myths of can cause sterility, can do this, it can do that, and so on and so forth.
It
Those are
is
three major problems we have.
It is Canvas and Niger-Delta Roundtable, brought to you by Renaissance Africa Energy Company Limited. And in commemoration of World Immunization Week, we're discussing immunization still saving lives. My guest is Dr. Uran. We go for a break. We'll return shortly. Conversation will continue. Please stay with us.
In the heart of our journey, where the sun touches the earth and the wind whispers through the trees, a new chapter unfolds. A chapter where energy illuminates more than just bulbs. It lights up minds. A chapter of unity, a coming together with a common goal to energize futures and illuminating lives. In classrooms, young dreams evolve, inspired by the promise of a brighter tomorrow fueled by available energy. Small businesses flourish, becoming seeds of prosperity. Energy that empowers and is catalyst for growth and change. The future is energy. So, let's light up the path to a sustainable future together. Energy for you, me, and the world at large. Energy for people and planet. We are Renaissance.
Welcome back to Canvas and Niger-Delta Roundtable, brought to you by Renaissance. I'm Dio, and we're discussing immunization still saving lives in commemoration of World Immunization Week. And if you're watching at about the time this podcast is published, it is currently World Immunization Week. My guest is Dr. Joseph Irang. Doctor, welcome again.
Thank you very much, Dayo.
Immunization. Now we're talking sustainable development goals. What is the connection? What's the nexus between immunization and the sustainable development goals?
First, let me talk about when they said water for all in 2020. I don't know if you can remember that. Food for all.
That was supposed to be the magical year.
Everything 2020. It's as if 2020 will not come. So at the end of the year, 2020 came, and we started having worsening hygienic situations. Because I grew up in Port Harcourt to some level. There were what we call water board was running, and almost all part of Port Harcourt, especially the town axis where we live. Will you see that is happening now? So now we have almost everybody having borehole, and you cannot even talk about the quality of water that is being produced in those boreholes. Now, looking at sustainable development goal, yes, it was moved from the Millennium Development Goal. They are still the same, almost the same, with few modifications. What are we talking about? Getting quality health for all. How do you get health? If you're plagued with vaccine preventable diseases, will you tell yourself that you're healthy? That's the issue. So immunization is one of the strong pillar of the Sustainable Development Goal, SDGs. So how do we sustain it? I want somebody to be healthy before the person goes to the farm. Agriculture for all. Is it sick people that go to the farm? If somebody is plagued with vaccine preventable disease, will they be able to go and do agricultural production? No. You cannot even say the person is healthy. So, in my opinion, immunization is one of the key pillars because you need to vaccinate everybody against vaccine preventable diseases. But in public health terms, we say vaccinate the large number of persons because it's going to be very difficult for you to vaccinate everybody. Because some people might not agree, some will travel, as at when your teams get there, and so on and so forth. Some might even be, you are talking this way, some are going the other way, and the rest of all that. So vaccinate as much as possible to get people on a healthy track.
I'd like to ask you a seemingly dumb question. Some might even refer to it as rhetorical. But how key is the role of health professionals in administering and promoting and ensuring the success of immunization? Say it does sound dumb because I mean I can't
It's not.
carry out
It's not
immunization.
dumb.
I'm not
It's
a
not
health,
dumb. It's not dumb.
but then again, also in the light of current developments, would even health professionals themselves joining the anti-vaxxers and promoting messages that discourage people from getting immunized.
Yes. We have that experience, and I can share one. I won't mention the local government. I won't mention the name of the place and the person in quotes. We were doing COVID vaccination. A health worker and said, "Okay, I don't believe in this COVID vaccination, but I'm a health worker. So all the people that are coming, I'll give you um, injection water, and I'll withdraw the COVID vaccine and this part, throw it away with the mind that I don't believe in it, but let it be that I've given you something, and everybody sees that I have given you something." Now, obviously, when we went and asked, what is the main issue? Say, well, she doesn't believe in it. Why don't you believe in it? Because her pastor, Christo Yakulomi, does not believe in it. It's okay. Is there any scientific backing? Oh, that this is the means of Antichrist coming in. Oh, science have not gone to that level. And the simple question I asked, when were you born? She said she was born in the 80s. I said, fine. Did you see post office in Port Harcourt? I said, yes. So were you posting? He said, the father even has a postal box, POB, and all that and all that. It's okay. So how many months do you later take from the US to come to your father's post box? Say so many people used to use her father's post box to receive mails from the US, UK, and all that. So sometimes it takes 1 month, 2 months, and before mail will come, you now respond. And that's okay. Now, do you still use the post office? Say it's more than 30 years you have not gone to post office, be 20 years. So what do you use in sending your message? There's email, there's WhatsApp, and all that. So why didn't you revert back to the post office? Since you're not used to improvements in life, so you want to go back to the old method because traditionally vaccines are made over 10 years, 20 years, and COVID vaccine cannot just be made over 1 year. So we'll go back to post office. Let us start writing our letters, go to post office, we'll post it inside the box. The mailman carries it to the airport. They carry from the airport, they go to through Nigerian Airways, as at that time, go to UK or US. Then your people will go and receive it and they will write back and all that. She became dumb. I said, because there is no scientific backing. Leave that side apart. You have health workers. How will they help us? Helping us in the sense that there are so many people that believed in their health workers. Assume you're a health worker. You came from a family. They've invested a lot of money on you. Even if you don't know anything, in quotes, even if you don't know anything, they now see you, our daughter, our son is a health worker. So anything you tell them about health, you're the first person they want to consult. And they will believe you as if you're a second God. So if you, that all this group of persons have trust on, now come and tell them that this thing that we are doing now is not correct, then obviously we have lost those category of persons because they will quote and say, our health worker, our doctor we trained, our nurse we trained, our house nurse, our personal doctor said so. So first, we try to see how we can build the capacity of these persons. As a doctor, yes, I'm a public health physician. That doesn't mean that I know all part of medicine. So if you talk about cardiology now, I have to tell you, we have to call a cardiologist. The highest I can give you is first aid and call in the cardiologist. So there are so many things in cardiology I will not know. I don't know if you understand. So somebody who is in cardiology cannot come and tell me more about epidemiology because I am in epidemiology and I know the small issues in epidemiology or probably in public health as well. So these are the issues. So when somebody now sees you, people see you, they say he's a doctor. The general assumption is he knows everything about medicine. And that's the assumption is wrong. So based on that one, you want to impress your people. You want to impress the people that are looking up to you. Even the ones you don't know, you want to tell everybody you know and say, no, this is not correct. Meanwhile, that is correct. So educating our people consistently will help in solving these small challenges because they have the key And there are a lot of people who believe in them. So if you educate them, give them the right information, they will be able to convince more people for you as well. So health workers are very key in immunization activities.
Some would say so are public health campaigns in raising awareness. But how successful are they, public health campaigns, in raising awareness and increasing immunization numbers to levels that we want them to? And also, what kinds of campaigns do you think will be most efficient?
Well, I'll give practical examples. Yeah. I like using COVID because COVID is the most rejected vaccine we have ever had because everybody was just fighting against COVID. At some point, people started coming. One of the success stories we recorded, we looked at the medical family, the doctor's family. So everything we want to do, every morning we post on the general doctor's platform the benefit of COVID vaccine. We try to talk of the history of COVID and post the vaccines and tell the benefits and the side effects of we call it adverse events following immunization. But for this discussion, I'll refer to it as side effects. So the side effects and all that. And on regular basis, we post and ask people to make comments and ask questions. So people will see some ideas of anti-vax and all, even among the community where you have medical doctors. So we'll now start addressing them. In some cases, you see videos from the US, videos from the UK, how COVID vaccine was administered and 200 persons died. The ones close to this one died and all that. And so all those unnecessary, so you start responding to them. In some cases, you see even some professors sending you stories on how vaccination has killed 300 persons, and you start explaining because you know they don't really understand it. So you have to now explain to them. So it is a difficult situation for us, a difficult situation that we have to continually educate our people. Continually. I don't know if I answered your question.
But the campaigns, do they actually work?
They do. Because, like at that time, when we did that, after doing that, there was a surge in the number of persons that accepted COVID vaccine. Why did I say there was a surge? Because you now have more doctors talking to their patients and clients that you need to take this vaccine. Because they've now gotten some understanding that was eluding them before this time. So that's where the problem is. So there have been huge successes.
You mentioned, interestingly for me, you mentioned even professors earlier on spreading misinformation.
I tell you
So, how does a professor in the medical field not have the understanding of how vaccines work in the first place?
Now,
because for you to attain this stage of professorship in any field of endeavor, you are regarded an expert in the field.
That's what I'm saying. So if you have, for instance, a professor of surgery who doesn't know anything about vaccination, and there's a pressure on him to talk about vaccination, what do you expect him to say? He's going to draw general conclusions from what he has seen outside, basically social media. That's what he's going to. So professor is a master of one small area. Even in that surgery, let's use surgery for instance. The person is now a master of small area. So you have surgeons that are cardiothoracic surgeons. That is all they know. If you tell them to come and do abdominal surgery, they'll tell you that's not my field. And truly that is not their field. You have neurosurgeons. Their own specifically is in the brain. You tell them to come and do heart surgery, they don't know anything there. So when you now use pressures and general opinions, I want to be the hero, because you're a master of a small area. Like for me, okay, I'm in public health. I'm not, you come to talk about maternal and child health and maternal health or maternal reproductive public health issues. I'll tell you, well, general knowledge, I can tell you one or two things. But where's my core area, epidemiology? When you come to, even in epidemiology, my small area, because that small area, infectious disease epidemiology, that's where I'm concentrated. So when you now come to non-communicable disease, I'll tell you, don't worry, I have a colleague in non-communicable disease. I can tell you about hypertension, I can tell you about diabetes, but I won't be able to tell you in details like the person who majored in that place. So what I'm trying, being a professor doesn't make the person know everything. Being a PhD holder doesn't make the person know everything. But you just know so much about a small area. That's a clear picture of what happens.
What would be the impact of declining vaccination rates if we ever were to have that in our communities?
The impact, once you have declining vaccination rate, diseases will start coming up. You begin to see outbreaks of these vaccine preventable diseases. Of course, the healthy state you want to talk about in the SDG will not be there anymore. So we try as much as possible. Yes, COVID 19 has helped in reduction, community rejections, crisis, insecurity, all those ones, myths, and so on, are joined in reducing or declining the vaccination rate in most communities. But once you see immunization, to me, like I tell everybody, it's like pregnancy. Pregnancy in the sense that the things you don't do now, it will show tomorrow. So how many months can you hide pregnancy? Hide it for 3 months maximum. People with blind eyes, you don't see them for 4 months. By 4 months, everybody sees that the pregnancy is out. So that's how immunization is. What you don't do today, it will show. Like I said, if you don't vaccinate, stop vaccinating. Those diseases you're trying to prevent will always come back. And they will come back in large quantities.
Well,
And it's like rain. You don't know the roof where it's going to fall. So which child's roof will you fall? Which family's roof will you fall? It might be your family, it might be your cousin, it might be your uncle. And that's why we need to see how we can work together. There's one thing I didn't tell you. Statistics is a very useless thing. Sorry for the choice of word, useless. Not useless in terms of derogating, but useless in the sense that it confuses everybody. Confuses in the sense that you can say 10%, 1% to that woman who lost her child, that is 0.1%, it is 100%. So what it means is that every opportunity you have to save a child is very necessary.
for the rest of us who are not in the health sector, individuals, communities, what roles can we play in increasing access to vaccines and immunization figures?
Like I said from the beginning, the only program in public health that has widespread is immunization. Now, what is lacking is acceptance. Yes, in this part of the world, acceptance is high. In this part of Nigeria, acceptance is high. But we want more acceptance. Acceptability of our health workers coming to these places will encourage them to come more. So, who are the people? Opinion leaders. You that is not a doctor as well, as a media personnel. Every opportunity you have to be able to preach to people to increase their health-seeking behavior. Majority of them is behavioral issues. But behavioral issues take some time for you to correct them. So we call them behavioral change. It takes a little time for you. So consistently, we begin to talk to them about the good health-seeking behavior, how we can prevent these diseases, and vaccination is one of the key processes to do that. I'm sure these situations will change. And over time, we'll be able to achieve a good story.
And finally, what ongoing vaccination programs do we have in the country and maybe in Rivers State inclusive?
In River State, like for River State here, we're going to commence the National Immunization Plus Days. There's this circulating variant polio viruses that had been majorly in the northern parts. They got it in Lagos, and we only had that in River State in 2021 in our environmental sample, not in humans. So the country is targeting on how to interrupt that process. So they've had a nationwide immunization coverage activity, which is called the National Immunization Polio Day Plus Days. So we're going to commence that on the 3rd to the 6th in this period. And we'll do the second round in June so that we'll be able to interrupt that process. We don't have it, but Nigeria is a country. So somebody can travel from where the virus is, and come to this particular part and still spread it. So we need to protect all our children and ensure that they have good protection as well.
Which other ones do we have ongoing currently in Rivers
Well,
State?
we just finished what we call the big catch-up. Big catch-up in the name, during COVID vaccine or COVID pandemic, there were interruptions in immunization services and other health services as well. Then issues of insecurity and the rest of all that. So we need to now do vaccination activities, deliberately catching up on those children that were missed in those period. So we did round 1, round 2, and we just rounded up round 3. And currently, in celebrating the African Vaccination Week, we are already doing what we call outreach services in 5 different local governments. Awoda East, Gukana, Kana, Obiakbo, and Eleme, 5 local government, just to flag off the African Vaccination Week or World Vaccination Week and see the additional number of children who vaccinate. Obviously, in the state, we've been doing outreach services to reach these children that are not able to come to the health facility and vaccinate them. All our intention is to get children vaccinated and protected against vaccine preventable.
And that's it for this episode. Canvas in Niger-Delta Roundtable brought to you by Renaissance Africa Energy Company Limited. We discussed how that immunization is still saving lives in commemoration of World Vaccination Week. Many thanks to my guest, Dr. Joseph Rang. Thanks for your time.
Thank you, Dayo.
You have yourselves a wonderful rest of your day and week, and rest of your life filled with good health. But critical to that is getting vaccinated. You and your loved ones spread the word. Enjoy the rest of your day. Bye for now.
Thank you, sir.